10 starts now.
Good evening, I'm Lauren Colbert.
And I'm Chad Mira. Thanks for joining us tonight at 10. Every 8 minutes, someone in the U.S. dies of an opioid overdose.
And to put that into perspective, from the time we start tonight's newscast to our first commercial break, someone in our country will have lost their life.
As the opioid epidemic continues, health officials point the finger at fentanyl as a huge cause in drug overdoses. KX News reporter Sanji Milburn reports in tonight's top story.
Drugs are popular in the Bismarck-Mandan area. The Bismarck Police Department responded to 19 overdoses this year. They say many more are never even reported. The CDC says fentanyl is now the #1 opioid overdose killer. Health professionals conclude that more overdose deaths involve fentanyl, either mixed with other opioids or taken alone. But what is fentanyl? It's a synthetic opioid pain medication usually prescribed by a physician in severe cases. According to the U.S. Drug Enforcement Agency, fentanyl is 80 to 100 times stronger than heroin or cocaine.
It either comes in a liquid form, a patch, and then it does come in a powder form when they extract, if it's extracted, but you can't really get the powder form in North America.
And when it comes to law enforcement, their daily patrol against drugs has changed as the opioid epidemic has taken over. The number of opioid overdoses are increasing so much that officers in the Bisman area are carrying around Narcan sprays as a temporary antidote.
The last one that I'm aware of where I was involved in was an overdose just north of the police department where we gave 4 doses to one individual. And then the other one got 2 or 3. That's how powerful it was.
Since fentanyl is only prescribed, for those looking for the same high fentanyl gives, they often look to heroin. It's a cheaper option. According to the CDC, from 2013 to 2016, overdose deaths involving fentanyl doubled each year. And for those lucky enough to survive an overdose, the recovery is lifelong.
I ask virtually all of my patients when they come in with an opioid use disorder if they've ever had an overdose, and I would tell you, I don't have the numbers, but the vast majority of them have had an overdose. Addiction is a chronic disease which responds best to chronic treatment. So I tell patients when they come through these doors, don't have an expectation that it's 28 days and then I'm going to be well. It doesn't work like that. We don't cure addiction here. We treat addiction and we teach people how to manage their illness.
Law enforcement say with the most overdoses unreported, the sooner you call in for help, the sooner a life can be saved. Reporting in Bismarck, Sanji Milburn, KX News.
According to the CDC, an average of 50,000 Americans die from drug overdoses every year.
With the